Go ahead.
Good afternoon, everyone. Myself, Dr. Kanchan Durugkar. Today, I am going to talk with you about the obesity and its effects on fertility. How the obesity is labeled and how does it impact the fertility and the reproductive function of a female patient is what we are going to discuss today. First of all, we will know how is the epidemiology or how much is the prevalence of obesity in all over India. Uh, so, in India, almost 135 million population is labeled as obese, and of this, 50% are adults and around 25% are children are labeled as obese. So, this is the it is also called as a obesity pandemic, and this is actually affecting the different stratas of society, and of course the different age groups also the obesity is affecting, and because of its so much prevalence, so much uh, population it is affecting, it is also called as a pandemic of obesity. Now, coming to when it is called as obesity and how we know that we are having excessive weight. So we generally calculate is the BMI, that is called as the body mass index. Now how it is calculated? It is calculated by uh, weight in kgs and height in meter square squared. So with this formula we calculate the BMI, and if the BMI, that is weight in kgs per meter square, so if it is 18 to 24 if is the normal BMI we consider it, and if the BMI is more than 25, then it is called as overweight. It is not called as obese, it is called as a overweight. And if the BMI is more than 30, then it is called as obese. And if it is more than 35, if this BMI is more than 35, then it is called as morbid obesity. So depending upon your height, the weight should be maintained. If your height is less, then the expected weight for your body type will be less. If your height is more, then your weight can be more, and that can then also the BMI may be normal. So BMI is basically weight in with respect to your height, and BMI tells us whether we are normal, we are having normal weight which is expected for our height, or we are overweight, or we are obese, or we are morbidly obese. So BMI is the parameter which is generally routinely used by clinician to know how much is the weight and whether it is falling in the proper criteria. Now, coming to what all obesity causes. As such, obesity increases your chances of you having diabetes in the future life, having hypertensive disorder, having atherosclerosis problem like ischemic heart disease, or you know some ischemic even we say hemiplegia. So these are the chances of overall health detriments that can happen because of obesity. Eventually, it will happen not in a 1 year or 2 year, but eventually the patients who are obese or overweight or obese, they are having the more chances of developing this diabetes, hypertension, and other clinical pathologies. Now, in our today's topic, we are going to discuss about how the patient or the female who is obese should be worried about her fertility, or should she at all be worried about her fertility if she is obese or not. So whether the obesity or the obese woman is having less chances of getting conceived, or does she faces infertility, or and if at all she faces fertility related issue, so what can be the causes of those fertility issues that we need to discuss. So we have first seen that when we call it as overweight, and when we called it as obese and morbidly obese. Now, coming to how obesity causes infertility. So actually obesity is a reason for the question for the first So answer for the first question was yes. Obesity is definitely causing decrease in the fertility potential or reproductive potential of the female. So how is causes? So basically, in 30 to 50% of the patient who are having obesity, they can have PCOS. Not all the obese patient will be PCOS, but 50% of the patient will be having PCOS. Now, in this 50% of the patient, obese patient who are PCOS, they will be having other hormonal uh, dis, dysfunctions like hyperandrogenemia, hyperinsulin, that is their insulin level is raised, their androgen level is raised. Now, why the androgen level is raised? Because of the adipose tissue, the fatty adipose tissue they have, they causes the peripheral conversion of this peripheral conversion into androgen, and androgen further is converted into estrogen. So these patients have more estrogen. Now, what this causes? There is also some dysfunction in the hormonal value, and this hormonal value leads to increase in the hormone called as a leptin. Now, this increase in leptin hormone and decrease in adiponectin named hormone. So, these hormonal uh, function will lead to decrease in the oocyte quality or anovulation. Maybe anovulation is when the regular rupture of egg is not happening, that is called anovulation. So this can happen in the PCOS or in the patient without PCOS also who is obese. So anovulation is seen, and if at all the ovulation is happening, then the egg quality may be hampered, and also the embryos that are formed can be of weaker quality, and their implantation into uterus can also be compromised, leading to less conception rate. So the obese woman who is trying to conceive will take more time to conceive as compared to the lady who is having normal BMI trying to conceive. So these are the issues that can be there in the patients who are obese and trying to conceive. Now, coming to what are the problems these patients can have if they are going for fertility treatment. So if they are going for fertility treatment, like if they are going for ovulation induction or IUI treatment, in this patient maybe the ovulation may be delayed. Like in the patient with PCOS, they may need oral ovulations, and along with oral ovulations are the tablets which we give for the ovulation induction, that is for inducing the ovulation. So along with the oral ovulation, sometimes injectable gonadotropins, these are the injections we give for inducing the ovulation, may be required. Now, along with the gonadotropins, there may be dysfunction in the ovulation. That means ovulation may be delayed, or there can be unsuccessful treatment in even of even if the ovulation is occurring then also. Now, if the patient is undergoing ART treatment also, in those patients there can be increased dose of gonadotropins will be required, like the patient's BMI is more. So in those patients, the duration of gonadotropin and the dose of gonadotropin, because the requirement will be less, gonadotropins dose requirement will be more. So and also it is seen in the various studies that the egg quality that is retrieved in the obese patient, also the embryo quality that is formed, will be of not that good quality. I will not say that it will be poor in every patient, but of course the egg quality and the embryo quality will be hampered in the obese patient as compared to the patient with normal BMI. And also, if the patient is undergoing embryo transfer, then the success of implantation or the implantation rate is also lowered in the obese patient. So this is about when the patient is going for the ART treatment and how can it be managed. Now, coming to the early pregnancy and the antenatal period. Now, in the ANC period or early ANC period, there is increased risk of miscarriages in the obese patients. Now, these patients have 1.7 folds increased risk of having early miscarriages as compared to the normal BMI patients. So, why this increased risk of miscarriage is seen in the patients who have higher BMI as compared to the normal BMI patients. So the reason is not clearly understood as far as the studies are saying, but it can be because of the poor embryo that has formed, or maybe the implantation related issue that is there, that can lead to increased risk of miscarriage, early miscarriages in the obese patients. Now coming to the pregnancy period or their ANC period. So, in the pregnancy period, the obese or the overweight patients may have increased risk of pregnancy-induced hypertension. So, pregnancy-induced hypertension is the raise in the BP that is detected only during the that ANC period or the pregnancy period, which was not there. The BP was absolutely normal, and it is raised during the pregnancy period. So this is called as a pregnancy induced hypertension or PIH. So there is an increased risk of PIH. Gestation diabetes. Gestation diabetes is the diabetes which has whole and solely detected during pregnancy. So gestation diabetes, PIH, preterm birth, premature rupture of membrane, large full gestation age babies which are large, or maybe IUGR, both the things are seen. Like the babies that are born to a higher weight mothers are not necessarily going to be of more weight. They can be preterm, or they can be even IUGR babies also, depending upon the maternal complication that lady faces during her ANC period. If she is facing PIH, oligo, or preterm birth, then her baby's weight can be on the lesser side. And because of the obesity, there is chances that these ladies may be prone, may have operational delivery, that is cesarean section, are somewhat seen to be increased. I'm not saying that every obese female will undergo cesarean section only, but somewhat it is seen that the patients with obesity have increased risk of cesarean delivery, and also the wound healing can be somewhat delayed because of the thick layer of subcutaneous adipose tissue or fat that is there. So that may lead to delayed healing. Sometimes wound infection are also seen in this patient, so extra care needs to be taken regarding hygiene and other things in these patients. So my dear friends, I will like to conclude all the points that I have talked in the today's session. That yes, the obesity, the incidence of obesity is increasing day by day, and it is not only causing health issues, other health issues like hypertension, diabetes, and other atherosclerotic problem, but other than that, it is also impacting your reproductive potential also, and it may lead to infertility also. So, and also all the obese patient are not PCO patient, and all the PCOS patient are not obese. This is also equally true. If the in the PCOS also, there are 40% of the patient who are lean PCOS, that we call as a lean PCOS. So there can be obese PCOS, there can be lean PCOS, and not all the obese patients are PCOS. 50% can be 50 to 60, 35 to 60% of the patients can be PCOS. Now coming to their fertility potential, so in these patients ovulation can be hampered, there can be anovulation, there can be problems in implantation and conception. So these patients may require more time. Then during IVF also, they may require increased dose of gonadotropins, and uh, also in the ANC period, some or the other complications can be seen. So strict follow and proper antenatal care is required. Even the multidisciplinary team approach may be required for the patients who are obese or morbidly obese. Now coming to the what are the different management, or what are the different ways that we can come up and have the successful pregnancy outcome in the patient with PCOS. So in these patients, weight reduction is very important. But yes, we should not delay the treatment of the infertile couple who is coming and having obesity, so we should not delay their treatment if at all their age is ticking, if they're having long duration of married life. So in these patients we should not refrain from giving them treatment for infertility. Also, we should see for what are the other causes, if at all there, like PCOS is there or other hypothyroidism, what are the other causes, and that need to be treated. In the patients with PCOS, metformin is a very good drug which we routinely use, and it has given a wonderful results, and it has induced ovulation. Also, the other oral ovulations and gonadotropins can be given to induce ovulation in the patient who are facing an ovulation. Of course, IVF remains the last resort, though for those who have tried all the treatments. So for them, IVF is remains the treatment. But for IVF also, we should consider that whatever the dose that will be required to the patient, and also whatever the outcome that can be there, should also be discussed with the patient, and accordingly the decision needs to be taken. And also she should be motivated that although she is having obesity, but she can conceive, she can carry a baby. Only thing, during antenatal period also, the weight gain that she is going to have should also be tell that it should be 9 kg or less than 9 kg weight gain during the 9 months should be done. If the patient, depending upon the, of course, the weight of the patient and other scenarios, the weight gain should also be kept in control. Then calorie requirement, or reducing the calorie intake, taking high protein and low carb diet, these are all the minor modifications that we can do. Then doing regular exercise at least 45 to 50 minutes. I always tell the patients that at least 45 minutes 5 days in a week also can be useful for you. And also 5%, even a 5% weight loss can break the vicious cycle of hormonal disruption and ovulation. So the even a 5% decrease in the weight can also help us. Even 7 to 10%, if the weight loss is there, then it can resume the cycle of ovulation. So this positive motivation should always be given to these patients. And if at all they're going for you know IVF cycle and embryo transfer cycles, in these patients the extra dose of gonadotropins that is required, and other outcomes should also be explained. Of course, there is a role of low molecular weight heparin in the patients who are obese and morbidly obese, because in these patients there is always a risk of having thrombosis in the vessels. And this thrombosis in the vessels, in the deep vessels, that is called as a deep vein thrombosis. So this deep vein thrombosis is having deleterious effect, and this can be prevented by giving low molecular weight heparin uh, in the at least in the first trimester to these patients. So my dear friends, I think I have given a valuable inputs regarding obesity and its association with infertility. If at all any questions are there regarding these sessions, I will be happy to take those questions. Thank you all the viewers. So, first question coming up is, how does obesity affect female infertility? So, as I discussed in this today's topic also, that there is some hormonal, dysregulation. There can be hyperandrogenism and hyperinsulinemia that can cause, ovulatory dysfunction. So, mainly the causes, and mainly most common cause can be, this irregular ovulation. Like in 1 month you may have ovulation, in other month you may not have. So this anovulation will reduce your chances of getting pregnant. If that in that month you are not ovulated, so that month will you will not have the chances of ovulation. So mainly the anovulation is the reason, or other reason can be impaired implantation, and other reasons like poor egg quality or embryo formation. If it is poor, then that can lead to infertility. So women's body weight can definitely impact her fertility. So we have upper body obesity, lower body obesity also is there. So it can be measured by waist hip ratio. Upper body obesity can be measured by waist hip ratio, and if it is more than one, then that is the central obesity is there, and that is more deleterious. That is again impairing your ovulation, and other problems can be there, like hyperandrogenemia and other problems can be there. What is the maximum weight to conceive? So weight as such will be difficult to quote as such, but depending upon the height of the patient, the BMI, I will say, should be less than 25. 18 to 25 is the ideal BMI for that height. So weight will depend upon, of course, the height of the patient. If the patient's height is good, she is more than more than 6 feet, then for her age, maybe the 70 kg weight is will also be okay. But if the the female is less than 5 feet, then for her even 65 weight will be more, 60 weight will be more for her. So the weight of the patient, or what is the ideal weight of that patient, depends upon the height. And that's why we don't see only weight. It is height, uh, and the weight, and we calculate the BMI, and then we say that this is not the good weight for you. So it depends totally upon the height and the associated weight of that patient. Does obesity make it harder to get pregnant? Yes, definitely. As I said that the if the female is obese, even in the males also, I have not discussed because it was not our today's topic, but obesity in both the partners is going to affect the fertility. In females, it is going to affect in the form of causing anovulation or other dysfunctions like hormonal disturbances. And in males also, it may cause less sperm count and other problems like hyperestrogenism and hypogonadism. So in those patients also, we can see there's a less sperm count, or maybe azoospermia also we have seen in the morbidly obese males. I think this is all from the question answer session. I will wait for 2 3 minutes if at all any questions are there. Otherwise we will close the session.